Sorry I haven't done a vlog. I have got some videos to go on, but I've not got the motivation to sort it out. I'll keep you updated. Oliver went for his operation on the 24th. And because we kept telling the hospital he has symptoms of an infection, and the doctors, and they just kept saying, well, the doctors tested him and said, yeah, he's got an infection, gave him antibiotics, because he's got a restriction to antibiotics and drugs and things, like good drug, like the hospital kind of drug, you know what I mean? He's got a restriction on those. Antibiotics, they don't work. So when he went to the doctors, they took them antibiotics and they said, oh, no, he's fine now. And we kept saying he's in pain still, like comes and goes, he gets pains in his stomach where his drain is. And it kept leaking. And so I went to a hospital like a month ago, and they said, oh no, we're not worried about all that pus and things. And I'm like, yeah, but it hurts, and he's in pain, and he's, and he's discharging. That's not normal. So the hospital said, oh, we're not worried. We think it's nothing to worry about. So they left it. I said, we got told it's an infection. Oh no, it's not an infection. Even though we did a swab and it was an infection. But the hospital said, no, it's not an infection. So we left it. We believed them. As you do, you've got to give your faith to the hospital. Even though I've gone through lots myself and through not same situations, but similar. Because obviously I nearly died and things because of my bowel and things, my tumour. But I still want to give them some faith and hope that they understand, I hope they realise that they do things wrong, and then they change and realise that they should be looking into things. So I thought maybe it's fine. 2 weeks before the surgery. Obviously it's smelling pus. That tells you that signs infection. That's a sign of infection. That screams out infection. All of the symptoms, apart from the shivering, they weren't bothered unless he shivers. They literally said, unless you shiver, then we'll worry. But it'd be too late then. I said to the doctors, I said to the nurses at the doctors, look, he's got signs of infection still. What did the hospital say when you went in a month ago? Because obviously I said we went to the hospital. They said they're not worried. Okay, we're not worried either then. I was like, really? I'm like, it's too late. I don't want him to miss his surgery because he gets sepsis just before his operation. That's what I said to the doctors. I said that to the doctors. And they go, he'll be fine. He gets the operation. Night before the operation, 10 a.m. 10 p.m. He's shivering. 2 hours shivering. I didn't realise until the last 15 minutes, but he started to stop shivering by then. So I thought, he's okay, It might be just all the tablets he took. I looked up in the morning, it stated that 1 out of 4 people can shiver from all the medication that you take before your actual operation. So I was like, okay, not worried, that's all good. We got to the hospital, got in to see the, ready, signing all the things to do the operation. He started throwing up and shaking. He was shaking and he was throwing up. I was like, no, he threw up first, and I said it's probably anxiety. He does that a lot when he's anxious, because he does. He honestly does. So I didn't worry about that. Me and his mum didn't worry. She asked me, she said, does he throw up a lot? And I said, yeah, that's normal. He throws up a lot. And she's like, okay. So we didn't worry. And we're like, he's fine. Then he started shaking. He was shivering and he didn't know why. And I said, I think he's panicking. I think he's worried. And we were trying to calm him down. They did the temperature test. 38 point something. And guess what? He has sepsis again. So he cancelled his operations. That he needed one is to get rid of the polyp that's turning cancerous, or might already be cancerous, they said. Might have turned cancerous now because it's nearly been a year in June. And they said 1 to 2 years, in the next 1 to 2 years, it'll be cancer. And it's nearly 1 year. Or if not, it's already cancer. So, because they said they only tested part. So he needed this operation. They said we can do an emergency operation to get the gallbladder out when they've done all his tests, make sure his gallbladder's, find out if it's his gallbladder that's infected. Obviously, they found out it was his gallbladder. So they did the operation yesterday, 4 hours later. So he went in at 3:23. I said bye to him. And then at 7:20, no, 7:40 odd, we get a call. Oliver's mum gets a call. Don't say much on the phone. They don't really say, oh yeah, we'll come and talk to you. No, they just basically say, we've left him incubated. Even though they know that he's a risk. If he's incubated for too long, his muscles will relax and they will be lazy and he could be on trachea. Right? That's what we were told. That's what we were told by the specialist because of his myotonic dystrophy. So, they basically said that. So we were like, oh my God, worst case scenario is happening. This is what we got told last time as well. When he was in LAS, because they wanted to incubate him, and we were like, no, because if you incubate him, the longer you keep him incubated, the less chance he's gonna come out of it. So they wouldn't incubate. So basically, because that's how his dad died, because he was incubated for too long. Yes, he had a bleed on his brain, but that wasn't why he would become brain dead. It's because he was incubated for so long after the fall down the stairs. They incubated him for too long, he died. But on the 3rd of November last year. So we were like, we don't want him to be incubated. And we told him we wished that he did not be incubated. And they said they couldn't get all the gallbladder out. It was stuck on his liver. And we're like, right. Looking up on the internet. And I said, can you die from having gallbladder left on your liver? Because that's what they told. And they go, and it says, yes, because it could become, you can have kidney failure. Not kidney, liver failure. Damage to your liver. I was like, right. So we were sat there for ages. It got to about 9ish. His mum was like, I've had enough waiting here. Let's ring in and see if we can get someone to talk to us. They were like, right, we'll come and get you in a minute. He's just settled and we'll come and get you. So they came and got us. Spoke to the doctor. The reason why they incubated him is because he couldn't breathe on his own. Because of how long he was left under general anaesthetic, he couldn't breathe on his own. So they had to incubate him and push some air into his lungs to get him breathing. And he slowly was coming off it. And they didn't, most people, they try and keep him under with general anaesthetic, don't they, or something. Well, they try and keep him under with lots of sedation. Obviously, he was aware of things. He could hear. His lip was moving every time you talked to him. And then the nurse decided to wake him up on his breathing thing out of his mouth. They go, bye, obviously because that's his real name. Your mum and partner's here. And he jumped out of his skin and went to pull it out, didn't he? Because you're not meant to wake someone up when they're on that. Because you're going to panic. Because you've got a tube down your mouth. And he was choking. And he couldn't... And they had to do that thing to get the stuff out. But the problem was it wasn't working. So they had to unplug that thing and pull it on the tube in his mouth and try and get it out. And then they sedated him because he still kept trying to pull it out. So they sedated him again because he was like... He was still there, but he was a bit more relaxed because he was a bit more sedated. Like, he was still awake. You could see that he was like... He kept trying to scratch his head. He wasn't touching his thing that time. He relaxed. He stopped touching his thing. It's because it was hurting here. And he was going, hurt. And he would drink. He was trying to say drink. I was like, you can't have a drink with that on. I was like, you can't have a drink with that on. Because he was going, drink. And we're like, no drink. But they sedated him, but he was still like able to move. I think my granddad was a lot more sedated when he was on that because he could hear us, but he was always asleep. Like, he didn't communicate like Oliver does. He was moving his mouth when we're talking, and then he started moving his hands, and I was like, no, put your arms down. So we had to keep pushing his arms down. And then there was one point where he was trying to reach up, and I thought he was going to go for that, so I made sure I put my hand there ready to stop him. Like, I didn't stop him, I just put my hand there to get ready to stop him if he goes for that. But no, he was going for his head, he was doing that. So I let him do it. So the doctor went, yeah, let him do it. He might not be going for that, he might be going for somewhere else. So I was like, yeah, that's why I'm putting my hand here ready, just in case he goes for that. But yeah. So that was a scary moment. And then today... They obviously weaning him off slowly, and today they actually got it out. Now he's on his ventilator. It's normal ventilator he has at home for his sleep apnea, so he is aware, he's awake, and he's out. He's not sedated anymore. He's just on loads of Pemimed, but he's now just got to wait for a bowel operation now. Hopefully it's not as bad. Even though we asked the doctor yesterday, we were like, what is it going to be this bad when he has his bowel operation? And they went, won't be as bad because he has sepsis. Because he has sepsis, his whole body is finding it hard to survive. So it's fighting. And, because we've done an operation where he's got sepsis, we can't, we had to incubate him for overnight until the morning when we could actually get him off. So they got him off at 8 a.m. So they said it might not be as bad. Might not be. The operation will be worse because that would be proper. They might be putting a stoma on him and that. We don't know. That's what I was told on my first operation back in 2017, and I never got a stoma then. I did get one later on. But they have to tell you that because they nearly gave me a stoma. I remember them saying, she's bleeding, because I woke up in my operation in 2017. And I remember them saying, she's bleeding. So I obviously woke up, tried to tell him I'm awake, and I couldn't open my eyes. Couldn't tell him. I didn't feel anything. I couldn't feel anything. I didn't feel the tube down my mouth or anything. I couldn't see it. I just was trying to go, I'm awake, but I couldn't talk because I had that thing down my mouth. I actually don't even remember having the tube in my mouth. Like, I remember waking up and I felt like I was trying to talk. Maybe I couldn't talk because I had that thing in my mouth. Now I know why I couldn't talk. But I couldn't even, it was like I was paralysed, because obviously they paralyse you when they paralyse your muscles and all that. So I was like trying to talk when I had, because this was 2017, the very first operation. And I was trying to talk I couldn't say I'm awake. Tried to open my eyes. I couldn't open my eyes. In the end, they went, "Oh, she's awake." But then they said on the end of that, they were so close to putting a stoma on. They ended up stitching it back together. Obviously, my second operation, I had a stoma put in on this side. Then my third operation, I had the stoma moved to that side. But yeah, basically. So yeah, basically that's Oliver's story right now. And I'm gonna be going up soon in a few hours. To see him, because he's finally awake. Oh, literally. About times we get told. We've been told obviously the worst, and we didn't think it was gonna happen. I was sure. But yeah, that's what happened, and basically. But he's still alive, and that's a good thing. And yeah, me and his mum just there, just trying to talk to him, and it's really hard to talk to someone when they can't talk back. And it's like, what do you say? What do you say? I didn't know what to say. I just kept saying, "The kitties are missing you." Then we just thought we'd joke around into him. We'd go, "By the way, we're gonna get a tattoo, right? Tattoo artist to come in and put a tattoo on your butt tomorrow." A smiley face, and yeah. Obviously, you couldn't say much back, but he was probably laughing inside. He's probably like, "Fuck off! No, you're not." Sorry for swearing. Sorry about the swearing. No, you're not. Hello, Clover. I've got a Clover. I apparently am sleeping in the front room, right? I feel like I feel more secured in the front room. In big bed, it's just scary on your own. Well, being in a big bed on your own, it's just hard. So basically, I'm in the front room, and I have 2 kitties laying on my belly the last 2 nights. Like, they lay on me. Cleo was laying on me from like last night. I don't know what time. I think Clover got on me, and I fell asleep with her on me because I felt her get on me and right next to Cleo. And I was like, "You need to lay down and go to sleep." And they both did. And then I woke up at 7 this morning. They were still laying on me. So I was boiling. They kept me heated, but I think they're missing their daddy because they never sleep on me. Both of them slept on me all night. But yeah, I'm going to put this vlog up. I have got some vlogs of Oliver's birthday celebration. But obviously, I need to do some smiley faces on the little boy that's with us playing bowling because I don't, he's my partner's cousin. And yeah, it's different when it's like my mum, my sister's kids, and that, because they're my nephews, my niece. But yeah, I'm just going to put a smiley face. So I need to do some editing, and I've not got the motivation at the moment. I just wanted to put something up and say I'm sorry. I am planning to get some reborn vlogs out. I have got plans, just at the moment. I just want to focus on Oliver, and I'll keep you updated. At the moment, he's on the mend. Like, yesterday he was put on that, or not. Had the operation yesterday, and he's on the med now. We just got to now wait for. He's got another operation, and now we've got a waiting game of when that's going to happen. But the good thing is, he's going to have the drain out. He's had the drain taken out. He's got a drain in for the operation to get all the gunky stuff out. Because obviously they left over from the operation. It doesn't have a cut on him. They did a keyhole, but then they told me they did a keyhole, and then I found out I had a cut under my belly. They didn't tell me that. Literally, they said, "Oh, Sarah had a keyhole." That's what they said to my mum when she came into the hospital. And then I went, "I'm hurting down there." Mum went, "You shouldn't be, because you had it done up here." And I'm like, "No, I'm really hurting down there." So I pulled my trousers down slightly, my pajamas down, Oh, I pulled my, because I had one of them thing, I put a cover over my, down below, and pulled that gown up, and I looked. I went, Mum, I've got a cut across my belly. And my mum went, they didn't tell me that you had a proper cut, like a C-section cut. That was 2017. I never got told that. I didn't even know until Mum told me. That's what I get. She's a very cuddly kitten. Come here. Oh, you want your blanket. You love blanket. She tries to suckle, but instead she actually just rubs her face on it. I don't think she quite understands. She licks it. I don't think she quite understands it's suckling on a blanket. She copies her sister. Yes, Cleo, come on then. Clee. Yeah, I know your sister's here. She's on the window over there. Can't believe you're 6 months old, baby. You're a 6-month-old baby and you look so diddy. Not as diddy as you were. She's 6 months. She's not dinky as she was. She's still dinky for her age. Still dinky for your age, aren't you? Look how dinky she is. I yawned and she went to put her face in my mouth, so I had to move my face away. Because she did when she was a kitten, she shoved her whole face in my mouth when I'm yawning. I'm so tired. My eyes look absolutely tired. It's because I didn't sleep much. The Cleo, I thought I'd show her Cleo. She's at the window. She was staring at me a minute ago. But yeah, I'm going to go because I'm going to put this vlog up. Sorry about the long talk, but I wanted to keep you updated on all of that. I'm going to put this up and I'll probably put a photo at the end showing you him in his incubator. But yeah, I will be sorting this vlog out, putting it into a video, and then putting it up with the photo at the end. Well, I could just edit it on Google, on the photo editor on here instead of the actual video editor. On the video editor on here, I mean, instead of actually going on my video editor place. So yeah, thumbs up, like my vlog, comment down below and subscribe if you're new. Thank you for watching, bye.